beginning, I used a shotgun treatment plan. And what I mean by shotgun treatment plan is I'd have a 45-minute new patient health checkup, if you want to call it Jazzy's checkup. And I essentially sat there and I used to do the examination, and I'd put some photographs and radiographs on the screen, and I'd start seeing things, and I'd start pointing them out, bang, 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 here's my shotgun. And I would start putting a treatment plan together. And in classic, SOE exact software, it'd be an itemized treatment plan, and boom, it'd be in somebody's hands.
So the patient's there, so your back is to the patient while you're doing this on computer. Let's talk about the
full parts
the detail.
Of it, yes. Yeah. At that point it was like that, yes. And a lot of dental surgeries, particularly when you're a younger associate, aren't really geared up for this, are they? They're not really arranged in such a friendly way where you can actually have a conversation side by side a patient. Because the reason why I evolved this, and it's become how it is now, is because why somebody chooses something often comes down to whether they know, like, and trust you. If they know, like, and trust you, then what happens is you've gone up in their estimation one level. And actually this happens beyond dentistry. The thing I always love to do is tell myself, nobody's going to believe what you believe in until they believe in it themselves. So if you can have somebody come up with a solution themselves to the problem that you have highlighted, and they put the words, you're not putting the words in their mouth, but they spit the words out themselves, holy moly, well, you've just nailed it right there, haven't you? Mm-hmm. So I used to think dentistry was kind of reliant on talent and personality, but what I realized over time was that I've become now reliant on set plays. Like in American football, there's set plays, there's scripts, there's ways that they've rehearsed, and I choreograph this stuff. And then I come along, and on my good days, I put my salt and pepper on top, and I do my talent, and I do my personality, and I do my charisma, and suddenly you're like, boom, I feel like freaking Spider-Man today, because there's like just webs, boom, boom, everything I touch comes to, just works, right? And then on those days, it's self-perpetuating joy, and you honestly come to work, and you're like, I can't fail today. This is all great. And actually, Jim, what happens is you produce better restorations. Patients walk out the door and advocate you. They become raving fans. We've talked about that before. Paddy Lund's kind of way of approaching things. So when you told me about the theme of this podcast, why do I invite patients back? I actually broke that down in my head. Why do I invite them back? Well, I enjoy bringing patients back for a presentation appointment, because I don't call it a presentation appointment. I just call it a follow-up consultation. But it's for a few reasons, and one of them actually is quite a serious, important medical legal reason. And the reason is because, in my eyes, you can't adequately consent somebody for X solution to Y problem, because you can't do that in one appointment necessarily, in my opinion, because it takes time for people to warm up to you, to open up to you, to trust you, to see you're credible. You're not a charlatan. You're not a sell. You're not an act. You're really doing it because it's in their best interest. And if you want to go even further, then you could say Montgomery level consent. If you're going to go with Montgomery level consent, that level of detail needs to be appropriate to the person or the patient, or any reasonable patient under those particular circumstances. But for that reason, it's ironically pretty impossible, isn't it? How can you possibly get to know somebody in a shotgun treatment planning type appointment? How can we know what's reasonable for that person or what's unreasonable? Because we're not blinking psychic. I'm not psychic. So I get to know somebody slowly and steadily. And my approach to it is that I, at all stages, want to mitigate my risks. I mitigate my risk by getting to know my patients. And I do that unhurriedly, I hope, and hopefully personably. And if you then do the extra salt and pepper, hello Bazza again, if you do your comfortable dental injection technique, and by the way, Barry hasn't taught me, I've never met the guy, I've just spoken a couple of times online and seen some of his work online and things. But, people like influences like that around you make you see, actually, that is how you join the dots, boom, 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 boom. And suddenly, that's, for me, the real art of being a successful dentist.
Hey, if you enjoyed this snippet from the Protrusive Dental Podcast, be sure to check out the full episode on www.protrusive.co.uk. It's also available on Apple Podcasts, Google Podcasts, Spotify, Amazon, you name it, it's everywhere. Also on YouTube. So check out the content. If you like it, please share it with a friend. Thank you.